For joining for this verbal session on water quality. Thank you as well on behalf of the Water Institute for joining for the UNC Water and Health Conference. We have 4 speakers for today, and we'll have time at the end of each session for questions and answers. And so I would like to call up to the stage or the podium Laura Allen Gates speaking about lead-free learning from RTI. Thank you. All yours.
Alrighty. Thank you. Small group, but that's great. Love that. So my name is Laura Allen Gates, as Timothy said, and I'm an environmental scientist at RTI International, and today I'm going to be presenting on our Clean Classrooms for Carolina Kids program. And so as the title suggests, this program is focused on eliminating lead hazards in child care facilities in schools across North Carolina. And so we're hoping today that our program can serve as a replicable model that other states or potentially even countries can adapt to protect children's health. So just a quick overview. I'm going to go through the program overview and then go into risk communication and mitigation support and then talk about some results to date. So program overview. So first off, why are we focused on lead? If you're in here earlier or have been to any of the other sessions about lead at this conference, you probably know already. But lead is a well-documented contaminant in drinking water, and that's largely due to its historical use in plumbing infrastructure, and this is worldwide. And lead can be used in piping, plumbing, fixtures, and solder. Specifically in the United States, initial restrictions on lead went into effect in 1988, and then since 2014, lead-free water infrastructure has been defined as 0.25% lead or below. And then lead-based paint is also, of course, of a large concern because it was used in building materials, especially before 1978. And with that, you're worried about the cumulative exposure, especially for children. And so that brings us to what is the Clean Classrooms for Carolina Kids program. It was launched in 2023 as part of a legislatively mandated initiative to identify and eliminate lead and asbestos hazards in all public schools and licensed child care facilities across North Carolina. And this is approximately 9,000 facilities. This program spans across 3 different sections: lead and water, lead-based paint, and asbestos. But for this presentation, of course, I'm going to be focused on lead and water, specifically the testing and mitigation of lead in drinking and cooking water. And so our program helps fulfill the North Carolina state rule requirements that were created to address lead hazards at child care facilities and public schools. And these rules require facilities to test for lead in drinking and cooking water, and then requires them to mitigate any taps that are at or above 10 parts per billion. Oh, okay, I'll just stand closer. Thanks. And so the Clean Classrooms for Carolina Kids program is funded through a $150 million contract with the North Carolina Department of Health and Human Services, NCDHHS. And they manage the overall contract and funding, while RTI manages the overall program, and that includes the testing and mitigation of lead in drinking and cooking water, which, like I said, is going to be the part of the program that I'm going to be talking about today. And so it's been almost 10 years in the making, and it's going to take it took a lot of time to develop this program, a lot of program development, and a lot of partnership to scale up to a program of this size. And so just wanted to point that out. So this slide just overviews the process that child care facilities and schools in North Carolina go through to complete the lead and water section of this program. It starts with them going through trainings to better understand the participatory science, also called the citizen science approach, as well as just the program in general. The facility is then instructed to complete an enrollment survey, and this includes inventory all drinking and cooking taps at their facility. And then using that inventory, our team and the lab team generates and ships a water sample kit to the facility. Once they receive that kit, the facility completes themselves, the first draw water samples for all the drinking and cooking taps that they identified at their facility. It's shipped back to RTI laboratory where the samples are analyzed. Once they're available, results and recommendations are posted on our online portal, which is super crucial to our program. I wish I could talk more about it today. And then facilities are encouraged to communicate these results, and mitigation support is available, which I'm going to get into later, but for any taps that tested at or above that state action level of 10 parts per billion. And so that brings us right into the next section of risk communication and mitigation support. So once a facility's results are available from the lab, we provide the facility with the results and, of course, next steps depending upon the results. Below the state action level and even above, we recommend clean water habits and low cost risk mitigation. So clean water habits might include using signs to designate taps for drinking and cooking, using the cold water setting, specifically at those cooking and drinking taps, and then flushing all taps regularly to clear out that standing water with fresh water. And some low-cost solutions include replacing faucet fixtures, water fountains, and specifically with certified lead-free products, and then installing a water filter that's certified to remove lead as well. And so at or above the state action level of 10 parts per billion, facilities are required to completely stop use of that tap for drinking and cooking purposes, and our program helps support those facilities to mitigate those taps. And so with mitigation support, so if a facility has one or more taps that test at or above the state action level, they will then complete a mitigation request form that's on that online portal that I referred to. We offer two different options for facilities to choose from. One is a partial service option and a no service option. With the partial service, this includes RTI purchases the products that are certified lead-free, and also filters, ships those to the facilities after we identify, appropriate products for whatever taps tested at or above the state action level, and then the facility coordinates their own installation for those. And then, of course, they have the option to choose no service if they want to purchase and install their own taps. But we do have resources available for facilities that that want to do it that way to direct them in the right direction of certified lead-free products as well as filters. And so after all these actions are taken to remove lead, of course, it's important to retest those taps. And so the last step is post-mitigation sampling to confirm that these actions did, in fact, work. And so risk communication, just briefly, we do provide a very large variety of resources, including flyers, guidance documents, videos for facilities throughout the program. And whether they have taps that tested at or above the state action level or not, they're encouraged to take steps towards reducing lead in all drinking and cooking taps throughout their facility and use those resources to do so. And so get into the good stuff, results to date, or I guess maybe not good, but interesting stuff. So at the start of the Clean Classrooms for Carolina Kids program, we've analyzed just over 39,000 samples from over 600 child care facilities. 3% of the samples analyzed were at above the North Carolina state action level of 10 parts per billion, and 23% of samples were at or above the American Academy of Pediatrics recommendation level of 1 part per billion. And also just a note that through that program development that I mentioned, we've actually tested some of these child care centers before. So those numbers are maybe a little lower than they would have been the first time, and that they are at schools which were being tested for the first time during this program. And so the second graph on this slide displays the maximum lead level at a facility. So 11% of child care facilities had at least one tap that tested at or above 10 parts per billion, and 51% of child care facilities had at least one tap at or above the 1 part per billion AAP reference level. And so these are the results specifically to schools as opposed to the child care facilities. So starting at the start of the program, since the start of the program, we've analyzed nearly 39,400 samples from just over 1,900 schools. 2% of the samples were at or above 10 parts per billion, while 15% of samples were at or above the 1 part per billion. And then additionally, 26% of schools had at least one tap at or above 10 parts per billion, and 70% of schools had at least one tap that was at or above 1 part per billion. And so far, as far as mitigation support, we've had 409 facilities complete mitigation. Among those 409 facilities, that has been 611 taps that have required and completed mitigation. And most commonly, as you can see from the pie chart up here, faucets were the most commonly that tested at or above the state action level, with water fountains as the second. And these required mitigation because of that. And then, like I mentioned earlier, this program spans across 3 different sections: lead and water, lead-based paint, and asbestos. So just wanted to show some results across our whole program, and this is both child cares and schools combined together. And it just really highlights how important it is that we're addressing cumulative exposure across both of these lead sources, water and lead-based paint, because you can see that there's several hazards that were identified, or several facilities that have identified a lead-based paint hazard as well, and then asbestos as well. So this is just cumulative exposure for children that we are addressing through specifically mitigation support. And then last, as you can see through this presentation and some of the other ones, lead is a common problem in water and other sources as well, but using an approach like this, it can serve as a replicable, scalable model that other states or potentially countries can use and adapt to protect children's health. So thank you everyone for listening. There's the information to connect if you would like to, and the QR code is for our RTI Clean Plus website, which has a lot more information about the Clean Classrooms for Carolina Kids program, as well as some other programs. And I'll just put a plug out there too, that there's a facility data mapper that has all of this information that that you all can access, but also schools, parents, anyone that wants to look at. So it's a really cool thing to see the facility data mapper. Thank you.
So yeah, anyone with any questions? This is a state-of-the-art facility, so it's all mic'd up. You can just speak out into the void, and we can hear, and also the online recording can hear. So.
Have y'all looked into it all about how to communicate this information to children as well in a way that they understand it but also doesn't terrify them?
Yeah, that's actually a great question. We do have a curriculum that we've developed, that we piloted and then developed, and some schools are using that information to educate the children, like you said. And I don't work on that part of the program, but I also just, if Jenny has anything that she wants to add to that, she's our program director. She can, you don't have to.
Yeah, it's really cool. So we also have educational researchers at RTI, and this is such a perfect way to educate kids in real life. And so the important thing was to map it to the educational curriculum and state standards by elementary, middle, and high school. So we tagged which areas that teachers would be able to teach kids in, and we worked with teachers of the state, and we have that online actually as well. And what we're working on is developing that to be nationally available and usable, and doing more piloting. So if you're interested in any way, you can check it out too.
Thank you.
This is such a great platform that you put together. What are the potential opportunities for that to be integrated into state and local systems if somebody else wants to replicate or plug into something like that?
Yeah, that's a great question. Repeat the last question part of it so I can make sure I understand what you're
If
saying.
state and local folks want to do a thing like that awesome system that you set up,
Right.
what is the easiest way to make that happen?
Okay. Yeah, I mean, I think, first of all, it's just getting it out there that we have this program, educating them on and showing, things like this, how we actually did it, and working, directly with us. We're wanting to expand and, reach as many children as possible with this. So, yeah, just like connecting with those, like you said, government officials, whether that's us or they hear about it some other way through some of our resources, stuff like that. So that's what I would say. Once again, I'll let Jenny add if she wants to.
Yeah, I mean, I think there's a lot of work that needs to be done on this, and our session this morning actually highlighted the local to state work that's being done that's intersectional. So I would maybe say you could go to the virtual recording of the session this morning.
And share it.
We have time for one more question. There's no, oh, yes.
Can you talk a little bit more about the challenges and benefits of citizen science?
Yeah, that's a really great question. So yeah, I mean, I'll start with challenges and then end on a positive note. But challenges is definitely just working with facilities as far as getting them to the materials that we're presenting to them is engaging enough that they know what to do and they know the importance of doing it diligently. So that's definitely a challenge. And I would say the benefits of it, though, is that we can do a program like this. If we had professionals that had to go out and sample, we wouldn't be able to do this magnitude. And I know it was especially important during COVID that this was all, the facility was able to do it themselves and then just ship it back. So, yeah. Thanks.
Great. Yeah. Thanks again, Laura. We'll now be shifting to our second presenter, Dr. Michael Fisher, from just up the road at the Water Institute at UNC. So, Mike, the floor is yours.
Thanks so much, Timothy. And before I get started, real quick question. He said, is it okay if I include you as a co-author on this talk? Trick question. No reason asking for a friend. Anyway, so this is some work that a bunch of wonderful folks, too many to list here, have been contributing on, looking at synthesizing published evidence on toxic metals in drinking water in low and middle income countries. And this is work in progress, but at the time we wrote the abstract, we hoped it'd be far enough along to be useful to communicate. We think it's useful to have the conversation about what is reported in the literature in terms of occurrence overall, broken down by region, by source type, and do we see any big important gaps in the literature? So that's kind of the rationale behind this work. And just to give a quick background, we've been talking a lot about lead today and always and everywhere. But in addition, WHO has identified a number of other chemicals of public health concern, including other toxic metals such as mercury, arsenic, and cadmium. And we have a growing body of evidence showing that inorganic manganese is toxic, particularly in drinking water, particularly to children, and that a lot of these different toxic metals can contribute to acute and chronic disease throughout the life course, and that many of them are particularly harmful to infants and developing fetuses, individually and in combination. And so there's lots of different reasons that we'd want to know what's going on with these toxic metals in drinking water globally. And in the US, we have access to a decent amount of data on occurrence of a lot of these in drinking water, but not as much work has been done to put together a recent, up-to-date, thoughtful synthesis of occurrence of some of these toxic metals in drinking water in low and middle income country settings. And so we know from the literature that they're harmful, they're important in terms of preventable burden of disease, and back to that word again, that they're preventable in many cases through a number of different actions that we can take. But what we'd like to do is, again, synthesize some published evidence and have a conversation about the prevalence of these different toxic metals at levels of public health concern in drinking water globally, overall, and also stratified some of the different ways that we might want to know. And so to answer that question, we did a systematic literature search and wound up getting a ton of evidence, more than we could really handle. And so we'll talk about that in just a minute. But we looked for all peer-reviewed literature published in the last 50 or so years, available in full text in English. And I'll mention when we come to the next slide that we only wound up excluding just over 1% of studies due to being available only in a language other than English. And so while we certainly would love to capture those other languages, we were pleased to see that the monoglot angle didn't appear to be excluding a big chunk of the evidence that our search returned. We looked for things that had usable primary data. So if you were, secondary analysis, we excluded you, but hopefully captured the primary data that you were analyzing, et cetera, et cetera. And we looked at a number of toxic metals that are, for which WHO has set health-based guidelines for the most part, and that are reported to occur in drinking water often enough to be an issue. So we looked at antimony, arsenic, cadmium, chromium, lead, manganese, mercury, nickel, selenium, and uranium as our toxic metals of health concern. We also looked at copper, iron, tin, and zinc as sentinel metals, with the general idea that at some point we'd love to be able to crunch the data and look at rates of co-occurrence of these with these other toxic metals to get clues about sources and transport and prevention, et cetera, which hopefully our brilliant students will help us with. Again, we captured 40,000 results. We couldn't read that many, and so we went to the wonderful health sciences librarian at UNC who worked with us to develop and train a machine learning approach to screen each of those 40,000 results at the title and abstract level and assign a propensity score based on how likely it is to be relevant to our study after we trained it by manually screening about 500 or so. And it did a pretty good job, and we described that in the publication, but the propensity scores did a pretty good job of matching what they were supposed to do. And so machine learning was able to weed out a little more than half of those, and then a massive team of screeners and collaborators then used humans to screen the remaining ones, and we got down to about 4,000 or so included studies. Anything else I want to say about that? Yeah, and extracted order of magnitude of almost 500,000 data points across all of these toxic metals to be able to say something about what's going on. When we looked at the quality of the data, it really varied. So we came up with sort of 10 method quality indices about did you do and report the sorts of things that we would hope you would do in order to obtain data fit for purpose, with all the way over here, 10 being best possible, 1 being worst possible. And what we saw is individually studies really varied with respect to method quality score. There's a few elements where we don't have that many studies, and that's why the histograms look weird. So individually variable, but collectively, when we did log normal diagnostic plots, and again, the literature suggests that occurrence of toxic metals in water, we'd expect it to be log normal, and so we'd kind of expect a big heap of data to have a broadly log normal distribution in the absence of big hiccups, issues, or biases. We saw, for the most part, reasonable fits with log normal distribution, suggesting that individually, method quality variable, but collectively, data across studies appear to be useful within a range of maybe a few orders of magnitude around the concentrations we typically care about for human health. In terms of the distribution of the data, the evidence map, we saw broad variability in terms of how many studies were included by country and region. So we found one region included about half of the studies, the Central and Southern Asia region, while Latin America and the Caribbean included only about 7% of the included studies and data sets. And again, that's not because of language reasons, we don't think, because we only excluded about 1.1% of studies on the basis of language. We also found very few by Europe and North America, but again, that's largely because many of the studies returned from that region were in high-income countries, which were excluded just because of what we're trying to answer. So we don't worry as much about that. So anytime something is there, but we are less worried about it, I've just put it in green here. By metal, we found relatively fewer studies reporting on mercury, antimony, and selenium as compared to the other toxic metals of health concern. And so these identified some evidence gaps that it'd be great to address in the future. In terms of occurrence of toxic metals, we didn't see any metals for which there were no reported occurrences at levels exceeding health-based standards. However, when we look at the non-targeted studies, so that's studies that didn't go specifically looking for contamination but found it anyway, we found that over 10% of the pooled samples exceeded WHO guideline values for arsenic, cadmium, manganese, nickel, lead, and barely uranium. And that's not to say that these numbers are the numbers. Almost for sure, more and better and updated evidence is going to change our point estimates, but rather it's to say we found occurrence of these at levels of health concern often enough that it's probably worth paying attention to. When we broke it down by source type, didn't see big differences. When we broke it down by SDG region, no region was immune. So no source type or region was immune from occurrence of these levels of concern, although there are nuances there. It'd be great in the future to include more literature, but the big takeaway is we probably have enough evidence to say that there's half a dozen toxic metals that we could reasonably be paying more attention to in terms of monitoring them, including them in national water quality strategies, and thinking more broadly about monitoring, management, prevention, et cetera, with respect to health-based targets. And again, we're going to get more and better data. They'll change our point estimates, but they're unlikely to change the finding that more attention to things like manganese, uranium could be very helpful. Thanks very much.
All right, as I previously mentioned, we've got time for some questions, and you can speak them out without a mic. Lyndon.
Yeah.
Hi, I was just wondering if you could talk a little bit more about the training process for your machine learning. Did you pull from a training data set? Were you excluding certain things?
Yeah, so short answer is Michelle Cawley and team have done this a bunch and published in detail, and they're geniuses, and they explained it to me, and I could badly try and repeat what they said to you, which I will do now, but if you actually want the answer, you should read their publications. My sort of simplified recollection is we came up with a representative set of returned results. We randomly selected about 500. We manually screened those the way we wanted to, and the machine learning algorithm was trained on the basis of that to then figure out how to go do something similar with the rest of them, and then it sorted them into categories, and we tracked how many from each category ultimately ended up being included or not, and saw that, oh, indeed, the categories that the algorithm thought were more likely to be included did wind up being included at the full text screening level at higher rates, and that gives us some confidence that we didn't miss all of the good ones by chance, but it's almost certain that we missed a few good ones by virtue of trusting a machine. However, the machine seems to do a pretty good job. Does that, without knowing the answer to your question, does that help address what you were curious about? All right, yeah. Oh, so we work together, so if we don't get to Jenny's question, I'll get to her later.
Yeah, so individually every metal in water is toxic, that we know. But I wanted to understand, have you tried to see like a combination of something, like if lead is with some particular metal, and that becomes more toxic? Have you done something on that?
That's a great question. So there's good work on that, and we're very interested in doing that for the subset of studies for which multiple metals of interest are measured and reported. The trouble is, if study A reports on arsenic and study B reports on cadmium, we can't say much, but if study C reports on both arsenic and cadmium, then we can look at co-occurrence. And so we're very interested. So one of the sub-analyses that we'd love to have students help with is, what can we say about co-occurrence of toxic metals of health concern as they compare to what's out there that's been published about exactly the sort of cocktail effects of multiple metal exposure. And I think that's really interesting. Another thing is, again, what's up with the sentinel metals and where we have co-occurrence, where we have reporting on occurrence of sentinel metals and toxic metals, what can we learn? And also where studies have reported on water quality parameters like pH, conductivity, alkalinity, which is not as often as we'd like, and can we extract those data? So there's a wealth of things that could give us good clues, and where we don't have all the things reported exactly the way we'd like, a really clever student might be able to make reasonable assumptions and still come up with some relevant inferences. I don't know if that can be meaningfully done, but one of our colleagues in the department does a ton of really good geospatial modeling, and so on our agenda after the conference is also to have conversations about, hey, what else can be done to quantify and report on co-occurrence where it's in the literature, and maybe even push that out a little more with modeling if it's appropriate. And for sure, there's good literature on metal mixtures and toxicity. We don't have any health outcomes extracted in our data set, so we can't build on that, but we can take what others have done and say, here's how big a deal we think it is relative to individual metal by metal breakdown of the evidence. Does that answer your question?
Yeah.
Do we have time for one more? Not really? Okay.
Not
Be
really.
ruthless, be ruthless. Thank you.
Yeah.
All right, Jenny, I'll catch up with you later. Thanks so much, y'all.
Thank you, Mike. And yes, we will have time afterwards to chat with presenters if you had any lingering questions. At this point, I'd like to welcome to the stage Dr. Shalina Shahin, who is joining us from Xavier University over in New Orleans to talk about pollution in Cancer Alley.
Good afternoon, everybody. I'm Dr. Shahin, and I'm assistant professor at Xavier University of Louisiana. And welcome to this formal presentation. And I would like to thank you, the Water and Health Conference, for selecting my work and give me the opportunity to talk about my project in this international platform. So over the last few days, I'm roaming around all the verbal presentations and plenaries and listening so many kinds of health issues, especially water, sanitation, hygiene. And when I was outside of the United States, I was also taught the same thing, like the people thought, like there is no pollution, there is no contaminations in this country, like United States or the first world. But the reality is quite different. So during my doctoral research program, I had the opportunity to work with some minority communities, especially in the rural areas of Louisiana, New Orleans. And I see that the peoples in this country, in this first world, in this dreamland of opportunity, people are still have some challenges for getting the clean water and some clean air as well. Almost, according to the CDC, it says almost 2.2 million people still have the limited access of safe drinking water, and almost 26 million people still have the still getting the water that has the violating the Clean Water Act in this country. So this is frustrating, but still we are here. So today I will talk about my project that is supported by the Novartis and also the Xavier University of Louisiana, and I'm the primary investigator. We started this project in this fall. So a lot of people don't know what is Cancer Alley, basically. So when I was talking in this conference, people are saying, where is Cancer Alley? Where it is? So I thought let's tell people what is this and why we are so concerned about it. So this is the Cancer Alley. This is the map of Louisiana. So Cancer Alley is a 85-mile stretch along the Mississippi River, and from New Orleans, Louisiana, to the capital of Louisiana, that is the Baton Rouge. And this is there is almost 150 plus petrochemical companies hub. Are almost 25% of the petrochemicals actually produced in this regions, and you see the dots, and all those are the petrochemicals companies. And these industrialized regions create almost 25% of the petrochemicals for these countries and outside of the United States as well. So why we are concerned? Who are the people who are at risk? There, in this Cancer Alley, 85 miles, that is 11 parish of the Louisiana actually involved, but who are very close to the Mississippi River, there is almost 20,000 peoples who are actually at risk, mostly minority communities, and mostly means 50 to 90% peoples are people in color, or the African American population, and rest of the peoples, they are white and all other low income communities. And their median income is less than 20,000, and because of their income, they have limited health access, limited infrastructural lifestyles, and all those kind of contaminations and everything's over there. So the peoples are like environmental scientists, environmental advocates. They say this is a sacrifice zone. Why this is sacrifice zone? Because this limits the cancer risks, and the cancer patient cross the limit of all federal exist. Okay, so that's why they said this is a sacrifice zone. So why we are concerned? What kind of environmental contaminants we find here? Mostly, these industrial activities release numerous hazardous substances like volatile organic compounds, benzene, toluenes, and some heavy metals like arsenic, lead, mercury, chromium, and the polycystic aromatic hydrocarbons. All those are contaminated. They are all the times they are releasing it to the air, water, and soils as well. So this turns really a death valley. These contaminants actually exceed all EPA and WHO regulatory limit in localized assessments, and particularly in groundwater and surface water source used by the nearby residents. There is a groundbreaking research recently published by Johns Hopkins, and they said there is a ethylene oxide is more than 1,000 times than EPA limits are found in the air of the Cancer Alley's regions, and the cancer risk is 11 times higher than any level of the federal government's limits. So this is really turns a death valley, basically. And if you go somewhere, if you get the opportunity to go there, you can see people has no jobs there because they are very minority communities, their food, their water, they try to cultivate them foods, they try to grow some plants, animals, so many things, but everything is contaminated and very highly polluted airs. They said, we can smell the air, but we have no other place to go. So this is the Cancer Alley. The research gap in this area is there is a lot of research happens with the air pollutions, lot of research happens with the soil contaminations. There is very limited research happens only on the contaminations of the waters in these regions. So our study, we are trying to investigate the contamination exposed and associated the health impact of Louisiana Cancer Alley, and through a multidisciplinary approach that integrated the water quality testing, spatial epidemiological analysis, and committee-based participatory research. And the objective of the study is to measure the contamination level, map disease patterns, and develop data-driving policy recommendations that advance the environmental justice and improve the public health equity. So based on that, we separated our project into the two hypotheses. The hypothesis one was the residents who are exposed to the higher level of chemical contaminants have a significantly higher prevalence of cancer and chronic illness compared to the people who lives in the low contaminations area. And our hypothesis 2 is the disease prevalence being disproportionately higher in minority communities and low-income communities due to environmental exposure and limited healthcare access. And our first aim to assess the water quality. So identify and quantify the pollutions in the local water bodies and the residential supplies. And we want to identify the heavy metals like lead, arsenic, mercury, and the carcinogens and volatile organic compounds and the endocrine disrupting chemicals. And this is our research parameters, and our sample collection we already started from last month. So the sample will be collected from the residential water sources and designated water plants in high-risk communities identified based on the historically polluted records. And chemically available strip will be used for community engagement as a quick and user-friendly tool to screen household water contaminations. And later, the laboratory analysis will happen by ICP-MS and the GC-MS to measure the organic compounds. And total, we are planning to collect 25 samples in 12 months for the seasonal variations, and we will compare the Environmental Protection Agency and WHO regulatory standard to determine the safety compliance. And we'll do the descriptive statistics and to summarize the contaminants concentration across the sample site to identify the key patterns of the variabilities. And we'll do the comparative analysis with the EPA and WHO and GIS mapping for collecting the hotspots and correlation and regression models. Also the spatial epidemiology to identify the disease cluster and trends and seasonal analysis. We'll do the evaluate the temporal variations in the contamination levels and multivariable modelings as well. I need 1 more minute. Okay, so this is our anticipated outcomes. We are thinking like identifications of the contamination hotspots, established of baseline data, and data-driven recommendations for the regulatory agencies and policymakers on necessary water environment interventions. This is our aim 2. The aim 2 is conducting the epidemiological study to link the environmental exposure with adverse health outcome and fill critical public health gaps. And this is our assessment for our aim 2. We will assess the rate of cancer, respiratory illness, and the waterborne diseases. And we want to examine the race, economic, and geographic locations as variable influence disease prevalence and aggregate the historical health data from hospital, clinic, and public health reports. And we'll also do the, I'm sorry. So the structured health survey from the community participatory research, semi-conducted interviews for the, conducted in the depth interview with the resident and healthcare providers, and water and air quality correlations and the conditions. And this is our anticipated result for those: identifying the contamination hotspot, establish the baseline water quality data, provide scientific evidence linked industrial pollutions, inform data-driven recommendations, support targeted public health interventions, and empower the local resident. And our project is ongoing. We started collecting samples from St. Charles and Ascension Parish, and our community partners is the Louisiana Battle Bridge. And we started, and hopefully next year I can come back with the result. Thank you so much for listening. And this is my communications. If you have any questions, you can ask me.
Time for 2 questions. If you want to select who you'd like to start with.
I don't mind. I want to answer as many questions as you have.
Okay. Yeah, we'll start with you.
This is really, really fascinating research, so thank you for sharing. So the name Cancer Alley, which, you know, those of us in the U.S., I think have heard that. I wonder if you hear, if this is built into the study, or if you colloquially hear, how do people feel about the area that they live in being called Cancer Alley, and what do they feel like they can do living there aside from moving, which most people don't feel like they can do?
Thank you so much. This is a very touchy questions, and I'm a primary investigator of this project, so I had to travel there. I went there several times in different parishes. So when I talked with them, I became really frustrated because I can't even imagine, like, people living in the first world and their like, lifestyles, their accommodations, their water quality, their food quality, even their infrastructure, household infrastructure is so poor, and their income level is so low, they can move. Someone said, like, I don't want to mention her name, she said her whole family are diseased. Someone from kidney disease, someone get cancer, their kids are like, raising with different kind of diseases and all kind of like, issues around their house, and they're just struggling. And this is also a mental health issue as well, because too much things going on, so many things, and they are actually stressed out with their life. So it's really touchy, and but this is going on over there. And so when I am listening the last whole week, the whole conference, people are talking about the third world countries and so many issues. So I thought, like, they don't know, like, even in the first world country, a big populations, 20,000 people, they are living in these conditions. Because I'm originally from Bangladesh, so we had thousands of issues, but we always dreamed from the country like they have no issues. But in this country, when I'm living here, I see that there is a lot of people are living with a similar kind of, like, the health issues because of the water qualities and air qualities as well.
I believe there's another question.
Just really quickly, Caroline Cavanaugh from COVA. I actually am born and raised New Orleans, like between New Orleans and Baton Rouge, so very familiar with Cancer Alley, unfortunately. And I wanted to know, this is sad that I guess I don't even know the information, but if, I've grown up, even when you fly into New Orleans, you can see all the factories on the plane when you're landing, and I know that there have been conversations between the local state government and those billions of companies over there, but do you know what, like, has any progress been made in the past decade on that? Or, I mean, I hate to say it, I think it's very normal. Like, I have 3 family members with cancer as well. Like, it's common, and I think it's to the point where we're desensitized to it. So can you speak on any, like, newer conversations being had?
So the thing is, like, the petrochemical companies, right, like, they have a lot of money. And whenever the non-profit organizations or the government or the people start talking, so everything actually shut down after some times, because, like, money talks more than people's, right? So there is thousands data, people are collecting data, we are talking, we are writing, we are doing our research, we are trying to publish, not only us, like, the several organizations, a lot of, like, non-profit organizations who works for that, but I don't think there is a drastic change happened in last 40 years.
Yeah, I feel like we never hear about it it's never on the local news.
No.
Yes, but, like, who talks, who works, their works. There is nothing happening that much. I can tell you, like, there is a drastic change happening in last 20 years or 40 years. But we are talking, we are doing our things. Yep.
Thank you so much. Thank you, Dr. Shahin. We'll all have to talk after, because I also worked in Cancer Alley at a chemical plant. I know I was a bad guy for a summer. So we'll have to chat about that. But in the meantime, I would like to invite up Dr. Ayse Ercumen from NC State University to also talk about some pollution in our backyard here in North Carolina. So thank you.
Thank you.
Oh.
And can you get me out of here?
Yes. Forgot that one part of my job.
You promised.
Yes, I did promise to public slides. And I fulfilled it just a little late.
All right. Good afternoon. You have made it to the last talk of the last session of the last full day of the conference. Thank you for being here. I'm famous for being a fast talker. I will get you out of here quick. But if you're getting lost, raise your hand and I'll slow down. Yeah. So I'm Ayse Ercumen from NC State University, and I'm going to talk about surface water quality impacts from non-permitted poultry operations in the Cape Fear River watershed And I'm going to get to in a second, like what's that business of non-permitted, that's in quotes. Right, so concentrated animal feeding operations, or CAFOs, apply vast amounts of untreated waste to nearby farmlands, and water quality and health impacts from these facilities are well documented. Let's see, yep, this works, both during extreme weather events like here, but also chronically throughout the year. The catch is, a lot of these studies rely on CAFO locations from public records, which are incomplete, or they can be incomplete, and here's why. All right, so swine CAFOs generate wet waste, and they store it in lagoons looking like this, and they apply it to farmlands in that wet form. And that makes them a point source of discharge into US waters, which then requires an NPDES permit, which then makes sure that their locations are publicly available in databases. For example, here in North Carolina, they're recorded in the databases of the North Carolina Department of Environmental Quality. Now, in contrast, poultry CAFOs generate dry waste and stored in heaps that look like this. So when it's dry, there's no discharge. That means there's no discharge permit, and that means their locations are not publicly disclosed in public records. At least here in North Carolina, there can be state-to-state variation. The USDA puts some of the information out, but it can be incomplete. An additional twist in North Carolina is that we've had a moratorium on swine CAFOs since 1997, which has kept their numbers fairly steady since then, but in response, poultry CAFOs have kind of been proliferating in that time frame, and we don't quite know where they are, and that makes it really hard to study their environmental impacts. So finding these rogue chickens is not trivial. Groups have tried to manually scan satellite images to try and find these facilities based on what they look like. We have a good idea what that facility might look like from air. Can be done, it's just labor intensive. So it's hard to scale, right? I read an estimate that it might take 7 years to just map all the poultry CAFOs across the United States, which then means you can't really keep up with the rate of proliferation. By the time you're done counting, new ones have been inevitably built. So other groups have taken Earth observation data, coupled it with machine learning, to bypass some of that manual labor, kind of pick up the pace. But these efforts are relatively new and far and few in between, and they are vulnerable to false positives and negatives. In other words, things that look like poultry CAFOs from the air, but are not, like roads and mobile homes and things like that. So given this background, our objectives in this work was to improve the accuracy of an existing poultry CAFO location dataset that was based on Earth observations, using additional selected heuristics from the literature for what these facilities look like, and just couple that with machine learning. And then once we know where they are, take that information and assess surface water quality impacts in the Cape Fear River watershed using combined CAFO location data, both from the DEQ records and our Earth observation data. Our study site was the Cape Fear River watershed, which is the largest watershed in North Carolina. And it also holds this distinction of having the highest CAFO density worldwide, with something like 10 million swine, 16 million turkeys, 300 million chickens raised annually within the watershed. The region is also highly vulnerable to pollution from these facilities because of its hydrogeology, including permeable soils, high groundwater table, and risk of hurricane flooding. Right, so it's kind of like a perfect storm. Increased contamination, both with nutrients and fecal coliforms, have been documented widely within the watershed, with this caveat that the poultry CAFOs may have been either incompletely or inaccurately accounted for because of that business of finding the rogue chickens. All right, so we obtained water quality data from the Cape Fear River Basin Monitoring Coalition, who have 145 stream sampling stations with monthly measurements going back a couple of decades. We focused on data for between 2016 and 2022 because the poultry data set we're working with was generated in 2016. So with these limitations, we still had, right, we landed with something upwards of 12,000 water quality observations for our analysis. We focused on nitrate, phosphorus, and fecal coliforms because nutrients and fecal contaminants are commonly associated with CAFOs. We looked at their continuous forms, but we also made these binary variables using sort of what's a threshold for exceeding ambient or background levels, right? So for nitrate, that was nitrate exceeding 1 milligram per liter. For phosphorus, it was exceeding 0.1 milligrams per liter. And for fecal coliforms, exceeding 200 colony forming units per 100 ml based on recreational water quality guidelines. Yeah? Am I too fast? How are we doing? Yeah? Everybody awake? Okay. All right, so our unit of analysis was this hydrologic unit code, or HUC, And we did our analysis at 2 different levels. We looked at HUC10s, or this 10-digit hydrologic unit code, which delineates a watershed. And we also repeated the analysis using the 12-digit code, or HUC12, which delineates sub-watersheds. And you can see watershed delineations and sub-watershed delineations within the basin in these images. So in our analysis, per a given HUC, we just tallied up the CAFOs using both data from the DEQ and our Earth observation data. And then we expressed those counts in quintiles. And then we assigned water quality stations to those quintiles based on what HUC they were located in. Then we just did them, some sort of fairly straightforward statistics using generalized linear models to compare water quality in the higher quintiles of CAFO counts using the bottom quintile as the reference. We used robust standard errors to account for clustering because we had multiple water quality stations within a HUC, right? And we had repeated measurements within a water quality station, hence correlated outcomes. We controlled for potential confounders. For example, we controlled for locations of other NPDES discharges and landfills because, right, as we're all kind of hearing, as we know, polluters typically come in a bundle. We controlled for cropland percentage to control for additional other fertilizer use that can be a source of nutrients. And we control for human population density to just control for human fecal waste. And then, as a sensitivity analysis, we also repeated it in our analyses, excluding urban HUCs, to further isolate the influence of human waste. So moving on to results, when we tallied up the CAFOs using the joint data, we found something like upwards of 100 CAFOs per HUC10 when we tallied them up by HUC10, and the maximum was closer to 500 CAFOs in a watershed. And then when we look by swine versus poultry, we can see that the poultry CAFOs at this point are actually substantially outnumbering the swine CAFOs, right? We can see here the red are the facilities in red are the swine CAFOs that are in the permits, and the ones in blue were the ones that we found in our Earth observation data with something like 1,300 swine CAFOs in the DEQ records versus close to 4,000 poultry CAFOs that we found in our Earth observation data. So this piece of the work we published last year. This was done by my colleagues in the Center for Geospatial Analytics at NC State. And you can read up about sort of all of the fancier parts of the stats and the machine learning and such. This piece of finding the chickens. And then, yeah, here's the highlight on the poultry CAFOs outnumbering the swine. Right, so now moving on to the water quality results, we found that nitrate contamination increased, not surprisingly, with CAFO count per HUC. Right, so I always tell my grad students who are like in the back there, hi, I always tell them, right, when you show a complicated table, you gotta break it down for the audience, right? So let's do it together. What do we have here? On the very left, we have the count quintile, right? Like how many, what quintile of CAFO count per HUC10 are we looking at? In the top for any CAFOs, in the bottom for poultry CAFOs. Right next to that, we have the count per HUC that corresponds to that particular quintile. Right, so how many CAFOs are we dealing with? And then the number of water quality observations that are in that quintile. Next, we have the prevalence of samples exceeding nitrate, where nitrate exceeded 1 milligram per liter. And these are expressed as fractions. You can multiply them by 100 in your head to get to percentages, right? So these are just all expressed as a fraction here. And then next we have the prevalence ratios, where we are comparing the higher quintiles using the bottom quintile as a reference, hence the dashed line there. Right, so when we look at these prevalence ratios, we see a sort of a neat dose-response relationship, which is always good when you're looking at causality, right, when things track with a dose response. So the higher the CAFO quintile, the higher the nitrate count, and that is the case both for when we look at any CAFOs as well as the poultry CAFOs specifically. Yeah, so that's for nitrate. Moving on to phosphorus, we actually did not see an association between CAFO counts and phosphorus, right? If you look at our prevalence ratios for phosphorus exceeding 0.1 milligrams per liter, we can sort of see that they're kind of all over the place with respect to the CAFO quintile. And then finally, when we looked at fecal coliforms, right, once again we saw that those coliform counts or the prevalence of samples exceeding, where coliforms exceeded 200 CFU per 100 ml, increased with increasing CAFO count. Right, and I'm going to point out like two things here. Right, once again, a neat dose-response kind of relationship, where the higher the count, the higher the percent of samples exceeding that threshold. And in this particular case, also, the effects really seem to be driven pretty heavily by the poultry CAFOs, right? These numbers are looking fairly similar to each other. So I only presented one set of analyses because of time. I'm aware that I gotta stop talking. But we did this in a variety of different ways, and results were consistent when we used the continuous forms of the water quality measurements instead of the binary. When we looked at the HUC12s instead of HUC10, when we looked at CAFO density per square mile instead of CAFO counts per HUC, and also in our sensitivity analysis, right? And I'm an epidemiologist. I really like sort of like slicing the data multiple ways, and if the story checks out, then we have a bit better faith in it. One limitation of our research was that we relied on existing water quality data. I mean, on the one hand, that was a huge strength because it gave us a large N and a long temporal sort of span that would have been really hard to do if we had collected our own primary data. But it also meant we had no control over the choice of where these water quality stations were located. And we didn't investigate whether they were representatively located or whether highly vulnerable areas may have been excluded from monitoring, which is a common concern, right, when we're dealing with sort of these types of data. The Earth observation data we used was generated, like that poultry data set was generated in 2016, so it certainly did not capture the facilities that have been built since then, right? That's one limitation. And we looked at surface water impacts only, which is important both for ecosystem health and recreational activities. But in terms of the health impacts, right, we're expecting that they're going to be driven more by groundwater impacts through private wells, which are also common in the area. So that would be a next good step to go into. In summary, we found higher CAFO counts associated with higher night rate and coliform levels with a neat sort of like that dose-response kind of relationship. No significant relationship with phosphorus levels, indicating that there's other dominant drivers of phosphorus contamination. And we found that at this point, poultry CAFOs substantially outnumber swine CAFOs in this basin, and they appear to be driving some of these observed relationships with water quality, especially for fecal coliforms, hence highlighting the need for improved documentation and regulation of poultry CAFOs. I want to acknowledge the rest of our team. These things are always a big team effort, including my former master's student, Becca Davis, who did most of the analysis, and our funders. They acknowledge my funders too. And I will take questions if I have time.
Great presentation, and we got time for one or two questions.
Yes, please.
Thank you for your presentation. I actually recently worked with an organization that wanted to map out CAFOs to migrant farm worker housing, and so the missing chickens really did bother me a lot. I wanted to know, how could organizations that maybe don't have all of this like GIS knowledge and stuff access this data and maybe be able to map it themselves, especially because it's so hard to access already?
Yeah, so that's a good point. I'd almost say, right, just work with researchers who've already done it. Like, I don't know that there's a need to reinvent the wheel. Like, once it's been done well, right, it's code, right, and code runs, and you can rerun code. Like, that's the beauty of it. So I think maybe it's important to identify partners who just have the technical know-how, and then work through them, and then maybe, right, like, work with periodic updates, right? It's dynamic, right? Like, if you have it today, it's not going to hold true like a year from now, likely, right? But I think the beauty is, right, so once the code is there, again, I tell my grad students, like, put things in a script, and then once you have the script, you just hit run. So I would say just find a partner who just has that technical know-how and can share. And I think in a lot of this work, our goal is to make the data sets publicly available. There are concerns around, right, like if you put all of this data out there, then does it mean we're like decreasing property values like in these counties, right? So like it's a little gnarly in terms of like put it out there for everyone, but if anybody asked us, we'd be like, oh yeah, like you can, right, like we'll be happy to share the data. So if you want data, let's talk.
Thank you.
Yes?
Great work. I think you should copyright rogue chicken. I'm curious if you have looked at the impact of storms, because
Yes.
I remember in North Carolina hearing a lot about swine waste lagoons overflowing. I know a lot less about poultry feces containment and how that would interact with like big storms and flooding.
Yeah. The water quality samples are time-stamped, so that can be done. We haven't done it. I mean, I would just kind of assume that even though it's dry waste, like by the time it rains, it's all liquid. There's liquid everywhere, right? So point source or no point source. So I think that's a good direction to go, to look at like either just kind of seasonality, though, I mean, there's research that's come out, right? Like this is a chronic thing that's like happening year-round. but there might be certain signatures following kind of major events, major weather events. And there's other subgroup analyses that you wanted to do too, right? If you just look at like the lower Cape Fear River Basin versus the middle, the bottom, right? And are these relationships holding up? So yeah, I'm taking notes on subgroup analyses by weather, for sure. Yes?
Yeah, that was my question, which is a really good one, which is, I mean, this work is so interesting, and it's impressive that the effect sizes are so large, just looking at numbers of CAFOs per huck. I guess I was thinking, could the effects be larger than they appear, and could that be more evident if we control for example, 14-day prior rainfall, or, for example, some rough estimate of sort of square footage of CAFO? The other thing I was wondering about is, could you consider second-order effects from upstream hucks?
Yeah. So the upstream issue is a hard one, right? So maybe I'm going to leave that for last. And then, so what was the other question? Sort of like, could there be like kind of hidden effects that you haven't?
Yeah. In other words, you see this massive and very robust effect, even without accounting for the size of CAFOs, just looking at the numbers, even without accounting for did it rain before the person took the water sample, you know?
Yeah. No, all good, all good. So it was all part of the intended work. Turns out finding the chickens is easier than estimating the numbers of the chickens, right? So we do have an estimate of the barn size, right? Like, and there is data somewhere that says if your barn is this big, there's this many birds in it. It's just we haven't made it to that step. But then you have the number of birds, but like, right, like you actually need to think in terms of animal equivalent units, right? Like how many birds is equal to like one swine? Like there's a way to like kind of, right, because they produce different amounts of waste. So you need to normalize across the board. Again, all of it can't be done. It's just that we haven't gotten to it. And in terms of the upstream, downstream business, I mean, I think the beauty of kind of working with the huck is that like if a drop of water falls within that watershed, right, like you're just kind of capturing the up and the down, like it just all, right, it's captured presumably by the water quality stations. And that's partly also why we did the 2 hucks, right? So like, what are the local effects within a huck 12? But if you look at the larger level, do we see a different kind of signature? And we didn't. And I will say very quickly, a lot of this literature that's kind of, you know, a lot of like the evidence that, you know, the body of evidence that we've built on, there is a lot of work where, you know, folks have sampled kind of upstream of a known facility and downstream of a known facility, and we're really trying to get around that because what's like upstream is certainly downstream of something else, and that's really dampening the signal. And we're hoping that in our approach, we kind of, it was like we caught everything, right? Like that drop of water that fell, we caught it in the monitoring station. Yes, can I do it or no?
Sorry, just to have fairness to have fairness, but there's plenty of time to chat afterwards. So we'd just like to once again thank all 4 of our great presenters. Great things happening here in the States and also internationally. I'd like to thank you all as attendees for joining for the last verbal session this year's conference. Thank you all for joining. We'll be wrapping up, but there is still one last set of posters, so please go out, see your fellow presenters and attendees there. And I do welcome you to approach with any extra questions, because I know I have thousands. So, thank you.
Did you see that?
You have questions and questions. Y'all should chat. I think we're
want to talk.
Especially if you're paying just to see your strips. Figuring out if there is a citizen science approach that could be used.
I don't think your question. Thank you.
For living
Yeah.
Yeah.
This is a coffee.
Yeah, fair.
I worked in Geismar. No, Geismar. Yeah, Geismar is
The animal side is
whatever it is, maybe just next to Ascension.
yeah, so like I think
It started around all 11. Yeah, so it's not a fort, but actually we joined.
what's the incentive?
Lovely. Let's see. Gonzales is the only larger town. It has a bunch of shopping there.
Yeah.
Yeah. Or, yeah, we need to talk about New Orleans.
Okay, I'll be here. I'm not going.
Okay, or I'm not posted.
Two? Perfect.
We can exchange our.
I would love that. I know I saw you on the schedule actually from Xavier.
Oh, that's okay.
So we ended up.
Let me open it.
Where in New Orleans are you from?
You know, like when the questions comes up,
Interesting.
so you all moved after.
Which elementary school did you go to?
Sorry?
Great job, thank you.
Thank you. You can take my cell.
Mine's all.
Very cool.
You probably know your aunt.
Time I report to chest study.
Maybe I'll ask my
Interesting.
moved at 6140 Argonne.
I mean, I'd be
There's the street that goes right in front of. Oh, I don't know. We moved there. We moved in 2002, and now my parents retired back there and live on 4th Street. So
I didn't think
mine's is Oregon, and then French. Yeah, we literally like if I go visit them, they're the block away from Hines.
So I
What accent?
Yeah,
I'm assuming it's
it's very weird. Intriguing. Wait, how old are you? Did we go to school? I'm 29, so there is a world in which we went to like daycare together. Because you were saying her went through.
yeah,
That's crazy.
well, I went to Little Gate. My mom was
Okay. Very cool. I went to, let's see,
Yeah,
my daycare was
I did.
Cubs Corner.
No way!
Do you know Cubs Corner?
Well, 'cause all my mom and all my aunts went to
Yeah.
No way.
That's so funny.
Okay, wow.
Very entertaining. Okay, you're at Cova. Okay, I see you hanging out with all the. Because I did a present. I'm assuming that
Yeah,
you
I
went to
went
Boulder.
to,
Yeah.
yeah.
I think
I'll come visit you at Coach.
Go about that.
Yes, absolutely.
Told me that,
Can't wait to chat more.
my mouth got really dry when I was presenting, to put one Tic Tac in.
Was that TikTok? Was
Perfect.
that-
Yeah, it works. Yeah, I've used it ever since because my mouth just gets really dry and I present, and then I'm like only thinking about that. I'm like, oh my god, my mouth is so dry.
Your variability in school.
you. So
How
I'll catch your phone. Ayse,
how likely is it that they all have one?
As far as like all the taps in that school, all the schools like in the area.
All the taps in school. And within the district, have you done like district level analysis?
Not yet.
Because I'd be interested if like.
Definitely happen. Yeah, we're not done yet. It's next year, so. Yeah. Yeah, it's honestly a good thing because it's not. Like, you might have a school,
What the
it's very surprising that, like,
She's great. She's great. She's like have much like slick path of
like, 'cause I worked on the mitigation side, and so I'm looking at the taps coming through.
Oh my god.
You know, a big school might only have 3 or 4. It's crazy knowing how many they have, and a lot of times it is like old facilities. Like we get these crazy pictures, like 'cause they send in pictures when we replace the fountains of these like ancient
Disgusting.
fountains that you're like, so cute. What was this? Yeah, if there's a, it's very interesting.
Something they had to tear down like segregation sign off of.
Yeah, exactly.
From the 50s, yikes.
And you wonder, and I mean, like I know some of the, like with communications with designers and stuff too, like I had a facility recently that reached out to us, like after they had already submitted their request to have mitigation, was like, oh, actually we just did some remodeling in that area, we took it out. So it's like, I know that schools kind of do remodeling in different areas. I think that's how you end up with like 3 old, all the rest of them replaced because of how like,
The thing was,
I think that's,
So you know I'm affiliated.
it's variable, but I don't see specifically.
Yeah, step in.
Like it's not like they bought. Set up at the same time.
And a lot of times you get it too, where it's like, oh, this water fountain.
I'm just, yeah, fabulous job.
Nobody.
Even though I uploaded
Coolers are weak.
Exactly. Yeah. Whatever. So I think that's part of
I'm not
Yeah, really.
I have more questions. Also, if you need to RTI chat, then.
No, I'm just loitering because I don't want to pocket manga myself.
Okay.
That's what I do if I take content.
I'm sure that you're aware.
Okay, very cool. Yeah, very
You
cool.
ever want these to turn
That
into?
you're aware that all the water fountains in Gillings have a scan me to see when I was last replaced.
RTI.
The RTI
Risk assessment primarily.
program that really did.
I don't know.
Quantics?
Yeah.
Awesome.
Yeah.
Yeah.
I did not know people who could do it. That's such,
Yeah.
you know, it's like still so hard to just have
And that's on mic, and I'm okay with that. Island innovation. I love those.
and simultaneously.
Yeah, that's unusual.
I'm going for poster. Thank
Perfect.
you so much.
No, thank you.
Great arrangement.
Doing a lot of work.
No, thank
It
you.
was my first time here. When I was student, professor always said, when you will get chance, go to the US. It's a great place for water quality, water research. I said, okay. This is my first project, first grant, and I
There at the time.
Fantastic. We're glad that you chose us.
yeah.
Excited to see next year's results.
Oh, yeah.
I'm especially
100%.
excited
I'm very
because, like I said, I worked there. I gotta see what parish that's in. I lived just
have
south
another
of.
project is coming. It's RCMI that we have just fund. I got that one too for next year.
Challenging.
So I will apply. I hope UNC will take me.
Yeah.
Right?
My grant will pay, so.
Taking your
I-
time.
Oh, yeah.
Yeah.
Get whatever questions we know or not just
Like,
I'll eat the cannoli off of this.
okay.
Sorry, I was going to, and we didn't.
No, you're fine. That sounds like okay. This is everything that's
A lot of information. Wherever you go, you will learn something.
Yeah, there's always something to hear.
Learning this one.
You so much.
And I totally do that.
Yeah. That's really cool.
Yeah, it's great to hear. My husband, I talked.
Yeah, I agree.
Now I have to go in the 70.
I gotta get up early.
I have to learn more. There's so many things going on over there.
Are you driving back to
I'm trying to.
New Orleans, or are you flying back?
I'm flying back tomorrow.
Yeah, I was in St. James Parish, which is right on the. We are literally the middle of. Let's see, that was one of our plants, and the other plant.
Over here in the corner, hearing your conversation.
Guys, oh yeah.
Do you know if anybody's reading?
Yeah. Okay, nice. Okay, that works.